All right, well, good afternoon to everyone. Welcome to the school year 2022-2023 K-12 COVID-19 testing program vendor webinar. We're joined this afternoon by our friends over at Achieve Health Management. And just to kind of give you all a brief update on how this is going to flow. I'm also joined today also by our colleagues at the Texas Department of State Health Services, also known as DSHS. And so how this is going to work is just in a few, I'm going to turn it over to Jeff or whomever else from Achieve Health Management. They will go through their slide deck, and at the end of the presentation, we will open it up for Q&A. Please use the Q&A feature at the bottom of your screen throughout the presentation if you have questions, and we will get to them either written form or verbally at the end. This session is being recorded and will be posted along with a link to the slide deck on the TEA website by the end of the week. So with that said, I'm going to turn it over to Jeff or to Achieve Health Management, and they can take it over from here.
Thank you, Damon. Let me go ahead and get our presentation deck up here.
You have the ability to go ahead and share. There we
go. Thanks, Damon.
Welcome.
All right. Well, thank you again. Hello, everyone. My name is Jeff Williams. I'm COO of Achieve Health Management. I know many of you on the call have worked with us before. And so to begin with, we would like to say thank you again to all of you who are joining us for another fun-filled, exciting year of COVID-19 testing. Last year, we had a chance to work with over 700 school districts and private school systems in Texas. And we look forward to continuing to provide COVID-19 testing products and services to schools, excuse me, to schools just like yours this year. So looking forward to working with you all. I'm happy to report that we've tried to limit the number of changes to our testing program this school year. We still offer a number of options for COVID-19 testing programs, from GenBody rapid tests at the lowest price you're going to find, to full service PCR testing options, and then staffing to help manage rapid testing or PCR testing. Our National Sales Director, Mark Christensen, he'll be speaking more about those programs at the end of the presentation. But I thought it would be good to share some of the updates to our program this year, some of the changes, so that we can discuss those up front and then see what questions there are about those updates to the program. So first off, a CLIA waiver is required for all schools working with Achieve Health Management this year. It looks like for pretty much all vendors, a CLIA waiver is required for all schools who are testing on campus. And so I think that's a key. Any school who is going to be performing any type of rapid test, or who would be administering a PCR test themselves, will be required to complete a CLIA waiver to get a CLIA number assigned for your district, and that can apply to all schools within your district. Or if you're a smaller school or a private school, you can get a CLIA waiver for your school or any campuses tied to your school. So here in the presentation deck, we do have some of the links that the TEA has kindly shared on their COVID-19 program webpage. We've been sending these out to a lot of schools to refer to. It's really good information. And so I believe we'll be able to point you all to this deck at the end of the presentation, and you'll have easy access to those links here as well. We also want to be sure that all schools participating in the grant this year do take a moment to get their application completed for the TEA. I know we've heard from some schools that they just missed that notice that they had to reapply. So I just thought we'd call that out to make sure that you're all aware. And then probably the biggest change, we wanted to make sure that you were all aware of the new reporting system for schools this year called Simple Report. So Simple Report is actually a tool developed by the CDC to help capture COVID-19 test reporting, tests administered, and the results of those tests. So it's actually a really cool tool. We're very happy with what we've been able to see from Simple Report. It really gives you kind of a one-stop shop, a simple tool to manage that individual test record keeping, and also to manage your district or school-wide reporting. So it has really good reporting tools on the back end, really good functionality on the front end to enter information into the system, and then to easily register those test results as your COVID test administrators are conducting tests. It actually provides really good visibility into the testing that's being done within your district or within your school. The reporting is easy to access, and it also provides individual test results to those being tested. I know that was a big feature that people asked for last year. And so Simple Report will actually be able to provide that, a copy of a test result, either via text or email. So that information will be sent out to the person being tested, and they'll have a nice copy of that, hopefully negative COVID test that was administered there on campus. Simple Report for us meets two important reporting requirements. It will, again, allow you to easily capture that individual demographic data and test results that get sent to the DSHS Health Information Technology Department. That was a key requirement from last year. And then it will also allow us to access your data that's being captured so that we can manage that report of tests being used each week, that count of tests being used that was typically submitted either at the end of the week or beginning of the next week. All that data in Simple Report is accessible by our team. And so we're able to go in there, count everything up for you, and do that report for you. So one less thing that you have to try to do yourself. Please note, there may still be some additional reporting requirements from DSHS or the TEA or your local health departments. So I can't say that this handles every reporting requirement that you have, but I know those two key requirements, this will easily take care of those. And again, we think it's a very user-friendly tool that we hope makes testing a lot easier for you and your staff. Recording tests in Simple Report is super simple. Once we've set you up in the platform, you have easy access to this conduct test dashboard. That's where you go in to look up users and capture the results of a test being conducted. There's a few ways to get people into the system. The easiest way is to send a link to staff members or parents and guardians of those being tested so that they can just ahead of time fill in their information and their demographic and contact information. If someone doesn't do that, it's okay. It's super easy just to enter a new record for a person in the system. Just takes a couple of minutes to type in their information, and then they're in the system. So if there's any future testing for that person, they're easy to access. And then there's also a way to upload or kind of preload all student and staff data if that's something that your school or your district wants to do. I know a lot of schools don't like to just push all the data in there, but some do. And so if you'd like to kind of have it all preloaded with everyone who you think might be tested throughout the school year, there's a really easy way to do that. And you can reach out to our customer service team for help doing that. One good feature of Simple Report, something we've been asked about a lot. So if someone's conducting multiple tests, you have a line of individuals, 6 feet apart going out of the nurse's office. It's really easy to start a test for someone. You can actually see that there's a 15-minute timer where you can set a countdown for the amount of time that you would need to wait for that gen body test to complete. And while you're waiting, you could actually queue up another person. And on this single dashboard, you could end up with multiple people queued up and having their test timers counting down while you're waiting for that 15 minutes to expire. So it's not like you can only do one at a time and then wait until it's completed before you can do the next one. It's a really good system, and it's really built to try to make your lives easier. So I think those who've been using it have been able to find that. I hope that that's the case at least. The reporting functionality, like I mentioned, is very accessible, very easy to use. The ability to pull information out of the reporting. Sorry, it's the results dashboard. I was trying to think of the word for that. The test results dashboard is easy. You can actually search by individual name if you needed to pull a test by for one individual person. Someone was asking, hey, I need a record of all the tests that were conducted for me this school year. You could do a search by date range if you just need to do a search for all the tests done last week or last month or last year. And you could also search by test results. So I know a number of you are asked for the positive test results within your district. And so you can actually just search by positive and by date range if you need to, and pull that information out for other reporting purposes. So again, a super easy reporting tool that is going to make it, I keep saying easy, I'm sorry, but it is an easy tool that makes it easy to access that information all within this one system. So to begin utilizing Simple Report, again, you do need to make sure you have that CLIA waiver number. So if you do have it, hopefully we've already been able to get your school set up. If you don't have it, it is super important that you get that CLIA application completed. It's not a complicated application, and the TEA has some great resources on their website that kind of guide you through that process. Once you have the CLIA waiver number, then we will go ahead and enter your school information into the Simple Report system. I just want to stress, which is why it's in red, don't try to do it on your own. If you set up your own Simple Report organization in their system, then it's actually something we can't access, which is okay, but then we wouldn't be able to help fulfill some of those reporting responsibilities for you. So I think you'll find it easier in the long run if you allow us to get your school set up within our organization. And that gives us access to handle a lot of the admin stuff for you, so you don't have to worry about it yourself. And it allows us to do a lot of the reporting for you as well. So be on the lookout for account activation emails if we've already worked to get your school set up in the system. Or I know we've also reached out to a lot of schools just to, again, asking for some more information, CLIA numbers or status of where your school's at in testing for the school year, so that we can get your school set up in the system. We've been getting a lot of questions about Simple Report, which is great. Let us know, if you haven't heard from us. We've tried to reach out to you, trust me. So if you haven't heard from us, definitely be sure to get back to us so that we can assist you in getting things set up the right way. Our contact information is going to be at the end of this presentation deck. So I think that was really it for changes. I know we'll save a good amount of time for some Q&A at the end of the call, but for now I'm going to pass it over to our National Sales Director, Mark Christensen, to talk more about some of those testing programs that we offer.
Thank you, Jeff, and good afternoon, everybody. So for this school year, we are offering a couple different products and services. To start off, of course, is going to be our PCR tests with completed laboratory results within 24 to 48 hours. We also are offering the GenBody rapid antigen tests. So we have those available if you'd like those. And then also our testing services, which of course includes the clinical staff. We have the registration portal, the reporting portal that Jeff was just talking about. We provide all the PPE, the administrative equipment and supplies. For PCR, we'll provide the prepaid shipping labels, shipping materials, and so on and so forth. And so really we are flexible, and we're able to customize this based off of your screening plan for this year. So we'll make sure that we can take care of all your needs for what you're trying to accomplish for testing this year. Jeff, next slide. So there's a couple of different ways you can utilize our products and services. The first of which would be with our clinical staff that can manage and administer testing on site. Outside of that, if you do not want testing indoors, or you just don't have the space for it indoors, our clinical staff can manage drive-through and drive-up testing. And so we can make sure we manage that whole process and those type of testing events for you. But also if your staff can handle all the COVID testing this year, you have the bandwidth for it, you don't need our staff, we can provide just the PCR collection kits and the rapid antigen tests as needed. And so your staff can go ahead and complete those yourselves. But just to remind everyone again, a CLIA waiver is required. So if you don't have that yet, please let us know. We'd be happy to help you with that process. And go ahead, Jeff, next slide. So lastly, if you do want more information on us, or you want to see this presentation again, you can go to our Texas Schools landing page. We have a QR code, and our web address here is at the top of the slide. Also, if you have any questions on PCR testing, rapid testing, the clinical staffing support there, I'd love to have a conversation with you. So my phone number and my email address is listed here in the middle of the slide. And then if you have any questions on what Jeff was discussing with reporting, whether it be reporting for last year or this reporting this year with Simple Report, any questions on previous orders, anything like that, you are welcome to reach out to our customer service team via email at txorders@achievehealthmanagement.com. So that's the end of the presentation. Just want to thank everyone for joining us today. And I guess, Jeff, Damon, is there anything else we want to add, or do we want to jump into some questions?
I think that pretty well covers the basics. I'm sure there's going to be a lot of good questions. And I did also want to let everyone know that Tammy Ciccone, our manager of staffing, is actually on the call as well. So I know that there's been a lot of questions about, testing programs, testing options, staffing options. And so I just want to make sure that, we have all the right people here to answer any questions you have. One other, or maybe just two other quick changes that I know I forgot to kind of stress in the presentation previously, but we do have the ability to offer staffing for antigen testing or PCR testing, of course, pending approval of your application and testing plan for staffing for the school year. So be sure that you do go through that process with the TEA first. But we can offer staffing for antigen test administration or PCR testing. I know that was one change, something we actually changed in the middle of last year, but a lot of schools weren't aware of it. So I thought I would stress that again. There is a separate charge for staffing for antigen testing or PCR testing. So do make sure that you consider that whenever you're thinking about how you want to best run your program this year. But those are options that we can assist you with. And then one other announcement, I guess it's not a program change, but we actually recently got some information from GenBody that a number of the expiration dates for tests that we provided last year have been extended. So usually the rapid test market, you'll see that tests have a shelf life of 12 months, and a number of tests from GenBody have actually been extended up to 21 months. And that does impact specific lots and specific expiration dates. And so we'll send out some of the details of that following the call. But good news, right? I know there's a lot of schools that do have some additional GenBody tests that they're hanging on to just in case they're needed. And so those expiration dates will be extended, which is great. Again, details to follow. I guess I can leave that at that. So without further ado, Damon, I don't know if there's any good questions we want to jump into.
Yep, and thank you, Jeff, and your colleague for the presentation. We'll now jump into some questions. And as you all are, as we mentioned at the top of the presentation, please drop your questions in the Q&A feature. And if you prefer to verbally say them, just click on the raise your hand feature and we'll call on you. All right, this is from Maylene Grant. Our kits will expire in October. You might have just answered.
I think I did.
I think you just answered that. So, yeah. Now, once.
Yeah.
Go ahead.
Maylene, we'll be sure to send out the actual extension letter. We do want to make sure that all schools have a record of that. And that will list, again, the specific lot number and expiration date that is impacted by this extension from GenBody, so that they go through a process with the FDA to make sure to get that extension authorized. And so I do know that only impacts certain lot numbers. I'm not sure why some lot numbers may not be included, but let's just double check the lot number that you have, and then we'll be able to confirm if those have been extended. More generally speaking, for tests that aren't being used, or for tests that may expire, that they will expire at some point. I know, Damon, I believe you guys have some sort of a process for reporting expired tests and how to handle tests after they're expired. Is that right?
Yeah. And this is this is in some of our guidance, and it'll actually be added to our FAQ this week. But once a test expires, you need to, on the TSRR, so on the test received and on the test services and received report form, you need to just go in and mark those tests as expired. And then in terms of disposing of them, you can dispose of any test that's not been used with your regular garbage disposal. So that would be how you do that. And then there's a question now in the, I think Diane is typing the answer, but well, I don't know, Diane, if you wanted to address that with the group about the CLIA waiver from TDM and if it's still valid.
Oh, sure. Yeah, I just typed the answer. So no, the CLIA waiver that was held by TDEM is no longer valid for the schools for this year. There's one vendor that's participating in our program that takes care of the CLIA waivers for schools, but the other 5 vendors do require that each district obtain their own CLIA waiver. And that's something that has to be done before orders are submitted, before they'll process your order.
That's correct.
Thank you. Christina Anderson, our school system is waiting for our simple report login information. Until received, should we continue to submit the spreadsheet on Fridays for reporting purposes?
Yeah, so good question, Christina, and common question. So we are, every school who sent us a CLIA number should have been set up in the system. But what we have found is that we've broken a record and we've exceeded the number of users that Simple Report thought that an organization would ever set up in the system. So we actually had a meeting with the CDC earlier this week just to talk about that they never thought they'd see this many users hopping into Simple Report at one time. And so it's been slow getting additional users set up in the system. The support team there is helping us work through the list, but everyone just has to get manually entered. So it's just taking some time. We will make sure if you have a CLIA number, Christina, that will get your information entered into Simple Report as soon as possible. So you do have a login. And I'm making a note to follow up on that. As to your question, though, so the old reporting process where you could send a spreadsheet to Crisis Go is no longer functional. So that process has been disabled. So anything you send into them, it's not going to be sent back to us. I would recommend that you keep track of the data on a spreadsheet. You can certainly send that to our customer service email team at txorders@achievhealthmanagement.com. That would probably be the best option. And we can make sure that data gets into the system. And this is a very temporary solution because we are getting all the schools and all the users set up just as quickly as possible. And I would expect that to complete this week. One note, you've got to make sure you have that CLIA number before you send any data to us as well, right? That's kind of that signal that says I'm testing on campus. And so that CLIA waiver number is kind of your authorization to continue testing on campus. So I know we've said it a few times, but I'll say it one more time. Just make sure that you do have a CLIA number before you do start capturing that data and sending it to us. Hopefully that makes sense.
Okay, she had another question to follow up. I understand that. Can you see her follow up?
Yeah. Sorry, I had just started. I understand that standalone pre-K campuses are no longer supported. We do carryover tests from last year that are currently on our pre-K campus. So I'm not sure if that's a question for us, actually. But
let me read it. Let me see. I understand. Sorry about that.
No, it's okay.
So pre-K. So let me say this. In terms of grant guidance from last year and going into this year as it currently stands, pre-K students, if they are on campuses with K through 12 students, so if they commingle, meaning they exist in the same building with students that are in grades kinder or higher, then they did qualify. They were eligible. But those that were their own early childhood centers, daycares, or their own pre-K campuses, they did not qualify. And that was the grant guidance since August of 2021, since the grant started. So now if anything changes, we will let you all know, but that is still the stance right now. What do we do to carry over tests from last year currently?
Yeah, I think what Christina is saying that she is a standalone pre-K, and she was given tests last year. And you shouldn't have been given tests, but we've got to get past that now. You obviously were given them, and you still have those on your campus. So yes, you should still continue to use them and still continue to record them in the vendor portal that you receive them from.
Got it. Thank you for that, Diane.
Yeah.
This is my email. Okay, this is my email.
Yeah.
I am in charge of health services.
And Patricia, is that information for a chief health management? Do they need your email? Who needs your email address?
Yeah, I went ahead and made a note, Patricia. If
Okay.
you have another question, feel free to.
Okay, so
throw it in
there's
the
her
question
email
box.
address that she put in there.
Yep.
Okay.
Diane and Anika, thank you for jumping in with some of those answers already. I see a bunch of questions answered. Again, I'm hoping that you've all seen some sort of a phone call or an email from us about some of the changes with Simple Report. I know it's one of the bigger changes just because reporting, it is so important in this program, right? So I want to make sure that all schools do see that. Even if you're not planning on purchasing tests going into the school year, this reporting portal is still available for you. So we want to make sure that we get it set up correctly. That there is an expectation that if tests are used, that they continue to get reported. So we're here to help with anything that you need, even if it's kind of slow this week, just because with all the schools coming back, there's just a lot of requests to get new users in, but we will get through them all. So I appreciate your patience.
And so
Okay, Patricia, I'll make sure to update your contact information so that we send info to you as well.
And so there's a number of questions from schools that have tests left over from last year, and you are free to continue to use those. You should be using them as a screening program, and you need to continue to record them in the vendors portal, wherever you got those tests from. Because that information is still fed to us. If you decide not to join this year, you do not have to fill out an application, but you can continue to use those tests from last year. And then on the day after they expire, you'll need to record them as expired in a test and services received report. That is the same place where you say, I received product from this vendor on this day, this order number. So I put the link in one of the questions, one of the answers to the questions that were posted.
Okay.
Diane.
Someone said renewal application TA has been submitted, but no response. Is that likely to be a hold? All applicants have received a response as of 1:15 today. So if you have applied and you've applied your status in terms of where your application stands, you should have gotten an email from Kobe Case this afternoon by 1:15. The allocation sheet also has been updated. So if you go to our website and look there, you'll see a list of schools that have been approved that are either approved to go fully ahead or have maybe a carryover hold. If your name is not there, then you should have got an email explaining that it's either your testing plan was not approved or you have an inventory report discrepancy, either it was not turned in or what you submitted does not align with the data that we have on file. So hopefully that answers your question. If not, let us know. Please continue to drop your questions in the chat.
I would just like to say that in the event that a school applies and receives a denial from TEA due to inventory numbers, then by all means reach out to Anika or I, and we can help you figure that out and see what the issues is and talk about what the issues are. And our emails have been dropped into one of the questions that were answered.
Thanks, Diane. I would imagine that based on the volume of emails that's in our customer service email inbox, many of you on the call have probably already sent us an email with a question, but again, feel free to ask it here if you're not sure.
Damon, did you want me to answer that question or are you going to answer it? If you're
Sorry,
answering-
I was on mute. And I would need to know what school district is this. That would help us better to be able to answer this question. Because not sure what district this is. Brownsville. Okay, I'll look into that momentarily. Give me just a second, but we can continue with any other questions or comments.
And so I would just like to review for everyone what the line is that goes through. So the first thing is that a school has to submit the application, and it does have to be a complete application. If there's something missing, then TEA is just going to think, well, they stopped in the middle and they're not going to proceed. So once a complete application is received, it will be reviewed. The test plans will be reviewed, and then TEA determines whether they've been accepted or denied. If they've been accepted, then allocations are figured out, and allocation sheets are posted on the TEA website twice a week. And then if they're denied, and if you are accepted, then you will receive an email. And then if you're denied because of your test plans, you'll get an email that says your test plans didn't meet the requirements. And if you're denied because your inventory numbers don't match, then you'll get an email saying your inventory numbers don't match. And then if you are accepted and you show up on the list in blue font, then that means you are allowed to order staff from vendors only, because you have a number of tests still on hand. You reported your end of year inventory and said that you still had tests on hand. So you can continue to use those tests. And if your school name is in black font, then that means you can order tests or staff from the vendors. And the number in the allocation column, the green column, is the amount that you can spend on tests up to that amount. And that's only for tests. You don't have to worry about staffing, is not included in that amount. And so the vendors monitor that dollar amount there, and they will be able to tell you how many tests you can get. Now, if a box of 40 is in the minimum to order is 40, then you can't get 50 tests. You would have to just get a box of 40. And then when you use 80% of those tests, you would have another allocation added there. And then you can continue to order. And you should be ordering enough for a month's worth of tests.
Thank you for that, Diane. And I just typed in to Brownsville, I just typed in a response to that. We were able to verify, and that might have been you with the second anonymous piece, but an email was sent at 1:07 to you all, to Mr. Alonzo Guerrero, regarding your application status. Please continue to drop your questions. Not sure if anyone else has a comment or wants to share anything.
And if your application is denied due to a testing plan, Damon, remind me, do they have to submit another whole application with new testing plans listed, right? Because they can't make a change to what they submitted already.
So how it's currently set up is a new application with an updated testing plan would need to be submitted. Yeah.
Okay.
And for suggestions, I think you already responded to that individually. Okay. Let me also say this. because this has been a question that I've gotten individually and that not only myself, but others have gotten. We do know that the CDC has announced an update in terms of screening testing, but the grant guidelines have not officially been updated. And so until Dishes receives an updated grant guidance, and then we receive that from Dishes, there wouldn't be any changes. Now, if there is a change to the grant guidance, then we would then, of course, amend whatever guidance we have to align with what the CDC is saying. So when we get that, if we get it, we'll let you all know.
I know there were a couple of questions about that CLIA waiver. I'm gonna just go back up to those links that I had about the CLIA application. Again, these are straight from the TEA website, so you'll find them there as well. And Diana, is this presentation is linked on the TEA website after the recording is ready, right?
Yes, he will be.
That's right.
He will be loading that. Yes.
Yeah.
And
So I wouldn't imagine someone will try to write down each of these web addresses, but they'll be easy to access there.
thank you so much for that, Jeff. On the TEA website, under applications is where you'll find the information on a CLIA waiver application. There is a quick start guide, just like Jeff lists here. And then the example that's provided is specific to school systems. So it says what to put there in each of the areas when it's a school that's applying for a CLIA waiver. Because some of the questions are like, who's your laboratory director? Well, you don't have a laboratory director at your school. And so it explains you should put your testing coordinator there. And farther down in the application, it says that you're not a laboratory and you're not some of those other things, but you're an other, and then you're a school district. So you'll see that on the example though. And then there is a charge for a CLIA waiver, and it's between $180 and $200. And you can use some school funds to pay for that. You can't use these funds for this program to pay for it. But you can use whatever other school funds that you have, and they are good for 2 years. CLIA waiver is good for 2 years. And Damon, they say that Alonzo hasn't received his email, so you'll check on that after this conference call to see the scoop.
We just resent one, not only to Alonzo, but to the other 2 email addresses that were listed. So
Okay, perfect. All right, perfect.
and as Diane said, I will say this, please continue to just visit our COVID-19 testing website. We constantly are updating the website. If not once a week, 2-3 times a week, just depending on what needs to be updated. So please continue to visit that website. The FAQ is there, the guidance documents, as she mentioned, the actual application, the CLIA waiver application and guidance. There's a lot of resources there that can definitely help you all. And we're trying to make sure, based on your feedback, that we continuously keep that website updated with the most pertinent information. So please check it out, weekly. There's a lot of information there that will continue to help support you throughout the school year.
Thanks, Damon. And I thought I would just add, again, to reiterate what Mark said earlier, there's a number of different ways to do this, from rapid testing to PCR testing to using staff, not using staff, just depending on each school situation. So if you want to talk through just some options for how this could be done, or just the options you have available to you, feel free to give us a call or send us an email. Again, all of our contact information is here, and we're happy to help.
Yeah. So
And I'm sorry, Damon. I'd just like to go back to Patricia's question. She had said that she had some, the person that was doing reports has left and she has 4 new nurses that need to be trained. In regards to the tests and services received report, I put that link on there as to where to find it. There's also an instructional information about filling out a TSRR. So if any of those, if you need any other assistance, then you can contact Anika and I, but hopefully what you need can be found on the TEA website.
And if I could piggyback on that, the training materials for Simple Report are sent out to every user who's set up in the system. We can send that out to anyone who needs it. We can send it out again. And we're also planning to have, we actually had a webinar last week as kind of an overview for Simple Reports. We'll continue to schedule some webinars in the future. So be on the lookout for an email about that. But again, if you need any information about how to use the system, we're more than happy to help as well.
Got it. Well, if there's not anything else, we'll leave about another minute or so. But if there's not anything else, then after about another minute or two, we'll go ahead and conclude this presentation. Once again, it has been recorded, and we will get this presentation recording up along with a link to this slide deck. Thank you again to Achieve Health Management for all you all have done and will continue to do to support schools. So thank you. Let's give about another minute and we'll see if any more questions arise.
No pressure, anyone.
Okay, well, with that said, thank you all for joining us. We have 4 more vendor webinars throughout the rest of the week, 2 tomorrow and 2 on Thursday. Feel free to join us. If not, they'll be posted. Thank you all so much. Have a great rest of your day.
Yes, thank you, everyone.